Hey, Dr. Rafich here from Vet Triage. We are continuing through this issue of JAVMA, May 1st, 2014, and we are doing pathology in practice. And look at that, that's gross. That's a mouse. That is a mouse. All right, this is a hamster. 10-month-old female Syrian hamster. It died after a 6-week period of weight loss, lethargy, tachypnea, abdominal effort. In picture A, you'll notice little cyst-like nodules on its skin, little bumps. And then in picture B, the thoracic cavity has got nodules everywhere in the organs, but also a mass at the base of the heart. And the chest was filled with a white, opaque fluid. This study comes out of the School of Medicine at Yale University, section of Comparative Medicine. So they did a touch imprint of the mass at the base of the heart, and they found a dense population of lymphocytes with small amounts of pale basophilic vacuolated cytoplasm. If it's vacuolated cytoplasm, I think usually means that it's producing protein, so there's activity. Nuclei were round to irregular with finely stippled chromatin and multiple nucleoli. That's where all the DNA is located, and so if there's stipulated chromatin and multiple nucleoli, you worry about there being active DNA production, and usually indicative of cancer with multiple nucleoli. Mild to moderate anisocytosis and anisokaryosis was evident with few mitoses. So mitoses is cell replication. Moderate anisocytosis means that there's a variety of different cell sizes, which is not typical. Usually you want to see like a homogeneous. And anisokaryosis is differences in nuclear material shapes and sizes as well. Rare tingible body macrophages and a small amount of scattered nuclear debris were present throughout the preparation. And so this is an arrow here of that arrow is showing the tingible macrophage. Section of skin nodule showed a neoplasm of variable size cystic lobules filled with keratin lined by stratified squamous epithelial cells, also known as a tricoepithelioma, and that's the bottom picture there. That's a hair cell tumor. That's what that looks like. The nuclei of the squamous epithelial cells were round and finely stippled chromatin, one prominent basophilic nucleolus. Anocytosis and anisokaryosis was considered mild to moderate. Gradual keratinization of the epithelium and lumen contained abundant lamellated keratin. The thymus and fibroadipose tissue at the base of the heart was affected by an encapsulated, poorly demarcated invasive cancer, round cells, and in a scant fibrovascular stroma. The cancer cells within the thymic mass had strong membranous staining for CD3, indicating T cell origin, negative for B cell markers like CD79A and B220. Thymic mass was positive for hamster polyomavirus. Morphologic diagnosis is lymphoma of thymus, lungs, renal lymph nodes, multiple tricoepitheliomas of the haired skin, and this is an infection of the hamster polyomavirus causing the cancers in this pet. Comments. Hamster polyomavirus is naturally occurring, highly transmissible. It's an infection associated with development of lymphoid and hair follicle tumors, first described spontaneously arising skin tumors in a colony of Syrian hamsters in Germany. Inoculation of cellular extracts of virus into naive newborn hamsters resulted in induction of lymphoma and leukemia. Currently, this viral infection is infrequent in laboratories but can be found in pet hamsters. With natural infection, the virus is transmitted horizontally via urine. So horizontally means from organism to organism. Vertically means from like mom to offspring. There are 3 main outcomes of this viral infection, either subclinical, tumors of hair follicles, so tricoepithelioma, and tumors of the hematopoietic system, most often lymphoma. It depends on the overall immunologic status of the hamster and the age. Infection of the older hamsters is subclinical with continued viruria, meaning that there's urine is passing the virus, as a result of the virus being in the renal tubular epithelium. Concurrent formation of epitheliomas and lymphomas is rare. At any age, infection with the virus can be associated with development of tricoepitheliomas in up to 10% of hamsters, although rates are often higher in colonies where it's endemic. Hamster polyomavirus targets hair follicle keratinocytes, and trichoepitheliomas develop via proliferation of hair follicle cells, especially those of the hair root epithelium. For hamsters, trichoepitheliomas have not been described other than associated with an infection. Viral particles can be detected within the cancer cells by means of electron microscopy. Typically, firm alopecia nodules develop on the head, around the eyes and the ears, spread to the ventral aspect of the trunk, back, neck, feet. Then multiple nodules will coalesce and form a massive confluent layers with uniform thickness of the skin. They're benign, they don't spread, but their size and number can become debilitating to the hamster. Hamster polyomavirus can also cause devastating epizootics of lymphoma with mortality rates as high as 80% within 4 to 30 weeks following infection. Lymphoma is most associated with infection of young naive hamsters, and the most commonly reported sites are mesenteric lymph nodes, liver, and the liver, less frequent small intestine, thymus, kidney, spleen, lymph nodes. Tumors of B or T cell have been reported. PCR assay can be used to identify viral DNA in the transformed neoplastic lymphocytes. A sample of the thymic mass from the hamster of this report was positive for the virus infection by PCR with 100% sequence homology with another report. There was no treatment for the infection, and the virus is markedly resistant to environmental decontamination, aggressive environmental decontamination, and increased use of personal protective equipment have failed. And so once you have infection within a colony, depopulation is typically recommended for eradication. Wow. Yeah, I had no idea about this one. This is all new to me. Very cool. Sad, but very cool to learn about this. It's a viral tumorigenesis. And so, it's not that spread, that consequence of a viral infection, especially a chronic one leading to cancer, is not an uncommon thing. But I just didn't know in hamsters that this happened. So there you go. All right, guys, we'll see you in the next one.